Hello and welcome to Telegraph Studios. I'm Alistair Greener and today we're discussing the very important issue of food security. And joining me is Dr. Brian Evans, who's the Deputy Director General at the OIE. So first of all, good morning.
Good morning, Alistair.
What exactly does the OIE stand for?
Well, the acronym OIE is derived from the original name of the organization, which was the Office International des Epizooties, so OIE. The name was changed a number of years ago to World Organization for Animal Health, but the OIE acronym was maintained because of its historical significance.
And what do you do?
The OIE, as an intergovernmental standard-setting organization, aspires to bring to the global community protection of animal health, animal welfare, protection of veterinary public health, food safety, food security, and the economic benefits that are derived through that on the basis that by protecting animals, we're actually preserving our future.
I think about my own supermarket shopping. I go down any time to my local supermarket. There's an abundance of food. I never have a problem. Am I therefore becoming a bit complacent? Am I in danger of misinterpreting the situation because of all the food I can get my hands on?
Unfortunately, there is a high level of complacency, and it's a very dangerous thing to develop when we're talking about food. Food, in fact, and food security is very intimate. It's one of the main determinants of health. And health, from an OIE perspective, again, is defined as humans, ecosystems, animals living together harmoniously. And it's that interface between humans, ecosystems, and animals that is at the root of a lot of the insecurity issues in food today. We have to understand as well that one of the most important elements of that complacency is the recognition that even in developed countries, if food security is seen as affordable, safe, and abundant, there are issues of food security even in the most developed countries.
It's clearly a very complex issue when you look at food security. So what are the biggest dangers, risks that we should be looking at?
Well, currently the bigger issues for us is the recognition that we've lived through a number of high-profile events in recent years, everything from Ebola most recently, pandemic influenza, SARS, bovine spongiform encephalopathy, or BSE. And the result of that has been the adoption of approaches which is basically paying for the consequences, not investing in the prevention. And in fact, what we're seeing most often these days is the fact that we're treating symptoms, not the underlying cause.
And you say we, who's we?
Well, the we in this case really refers to governments at large in terms of what investments are they making in terms of their animal health infrastructure. Are they investing in early disease detection? Are they investing in good disease reporting? Are they investing in good disease surveillance and animal movement controls? Because in effect, with 60% of human diseases having a source in animals, it's imperative to protect human health that we are protecting animal health.
You're concentrating primarily on animal health, and I'm thinking that perhaps you're looking at prevention as the key to it. I mean, is that the solution that's going to solve all of this?
It is part of the solution. Again, I would be very cautious that from our perspective, from the OIE perspective, as a science-based organization, we recognize that science can determine what is safe, but society will determine what is acceptable. So there's a very important dialogue that has to take place so that we can link the science and the technology to being part of that solution. And in fact, the food chain doesn't start with the animal. In truth, the food chain starts prior to the animal. It starts with the ecosystem. And so animals themselves are sentinels to the health of that ecosystem. Safe food comes from healthy animals come from healthy environments. So issues around water quality, chemical contamination, radionuclear contamination, bacteria, viruses that exist in the natural ecosystems can enter into the animal system, obviously, through water consumption, through grazing on crops, through animal feeds. There's other important impacts, or inputs, I should say, at the animal level as well. We have to look at the husbandry systems. We have to look at the inputs in terms of veterinary biologicals, quality vaccines, dealing with the issues of counterfeit drugs. All of these are part of how we can, at the front end, make sure that we're not losing animals to disease that are now not able to get into the food supply, and that those animals who do get into the food supply are not introducing insults into the food supply.